further ado, I would like to introduce our presenter for our workshop today, Erin Freund. Erin is a board-certified music therapist with Music Speaks. She works in the Chicago area. She has experience working with a variety of populations, including older adults with memory impairment, adults who have experienced strokes, adults with substance abuse disorder, medically fragile children, and people with developmental disabilities. She has specialized training in NICU musical therapy, working with premature infants, and neurological music therapy. And also as a classically trained harpist, you can see her harp there, and completed her doctorate of music performance degree prior to becoming a music therapist. Whew, that's a lot and so amazing. And we are so honored to have Erin join us today. Welcome and thank you, Erin, and please take it away.
Hi, everyone. Thank you so much for attending today. Thank you for that introduction, and I'm intrigued by that question. Like, would you rather listen to your grandchildren or your grandparents' music? I think it just speaks to how strong music is in our culture and how it affects us so much personally. But thank you for taking time today to learn about music therapy. I hope today that you will know what music therapy is very clearly, that you will know who music therapists are, and how you can use music in your own self-care outside of a music therapy relationship, and why you may or may not be a good candidate to explore music therapy for yourself. So without further ado, I would love to tell you more about music therapy, and we will try some things along the way and answer questions at the end. I have a question to throw at you at the very beginning here. What is music therapy? You may see music therapy or what may appear to be music therapy in lots of different settings, like someone singing with an older adult who has Alzheimer's, working to increase verbal communication. Or you could see someone using music as a focal point with patients in a hospital to decrease pain perception. I invite you to take 1 minute, look at these different ideas, and guess for yourself, is this music therapy? Yes, or is this not music therapy and something else? See if you can guess yes or no, and we will come back to these at the end of the session, and I hope you feel really confident with your answers. Like, yes, I know that is music therapy, or I know that is not music therapy, and that is music being used in a different way. All right, I hope you have some questions in mind and we will get those answered. Just a little bit about me. I'm so happy to speak with you today. I am a board certified music therapist with an agency called Music Speaks. We work with facilities and individuals across the whole country. We have in-person and virtual services serving all kinds of clients with different needs. I have NICU training, that is neonatal intensive care. Training working with infants with their early growth and health and feeding. I've worked with a variety of populations, including people experiencing substance abuse, medically fragile kids, working with people who've experienced strokes and have other high needs. And my first experience with music was as a classically trained harpist. I had kind of a windy road to becoming a music therapist, but I'm going to incorporate harp into how we're engaging with music today. I would like to start today just centering ourselves. We're going to try something that you can do at home. It's called music meditation, and this is helpful if your thoughts are kind of busy today, if your inner dialogue is churning and you just need to be still and quiet things down. I'm going to play a slow, relaxing piece of music. If you try this at home, you could also try and find a slow, relaxing piece of music without lyrics. I invite you to get into a comfortable position. You can close your eyes or keep them open. Your job is to stay focused on the music. If you find your mind wandering onto other things, that's okay. Redirect your attention back to the sound of the music, back to this moment. think about what this song evokes for you in your emotions and in your body. And we'll do this for a couple minutes. After focusing on the music, my hope for you is maybe your thoughts feel a little calmer now in this moment after that. And maybe you feel a little bit refreshed. And that's something very simple you can incorporate into your days where you just need to slow down and pause and stop those worries for a moment. That was an example of music meditation. Back to our big questions that I promised you some answers to. What is music therapy? Here are a bunch of big technical words. Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialized professional who has completed an approved music therapy program. Whew, that is a lot. Let's break that down. Each of these components are really important to create a whole of what music therapy is and how it functions. My favorite words in this definition are clinical. That talks about the setting where music therapy happens. It's an established health profession. Think about physical therapy, occupational therapy. Music therapy is one of those peer therapies. It's clinical, dealing with patients. Evidence-based means that we have research and science driving what we do in music therapy sessions. We're not guessing, we're not making it up as we go. We have science behind what we are doing and the outcomes we're working for. Music interventions means the stuff we do in the session. It could be singing, it could be playing instruments, but they are musical tasks, the stuff that we do, and they're designed to achieve specific non-musical goals. I love those words. Non-musical goals means we're working on something big that applies to your life. Maybe it's focus of attention. Maybe it's speech production. Maybe it's extending your arm, but it's something non-musical. We're not working on singing well just for the sake of singing well, the way you might in a vocal lesson. We're working on something non-musical. Individualized means that the goals are tailored to you and what you need to thrive in your own life. And so they could be something physical, emotional, cognitive, or social. Therapeutic relationship means that you're not in this alone. You do this with a therapist. It's about that relationship with someone who has special training. A credentialized professional means that we are all certified by the Certification Board of Music Therapists. That means we take a comprehensive exam, testing our knowledge and our skills to know that we really are up to the challenge of all this entails to give good care to our clients. And accredited program means that we went to a college program whose curriculum is approved by our guiding association. How is music therapy different than music education or music entertainment? This is a really important question. Sometimes the things we do in a music therapy session could look, if you just dropped in on a session, maybe like entertainment, or it could look a little bit like music education, teaching someone to play an instrument. The reason they are different are their varied goals. In music therapy, we're working on something non-musical through music, like speech, like physical movement, like social interactions. In music education, we are working on playing instruments for the sake of playing the instrument very well. The goal is the music rather than that larger life thing. In music entertainment, the goal is enjoyment and leisure and love of music and relaxing. The goal is different. In music therapy, we're not working on music. We're working on something more transformative in your life that will apply outside of music therapy sessions to your regular life. How can music therapy do so many things? Music is very cool in that it covers a lot of domains. Sure, it's sound, but music can have a physical component. If you're playing an instrument, something is physically happening with your fine motor. If you're playing guitar or piano, if you're moving to music, there can be a physical component. There's an emotional component to music. Music can make us feel larger than life. It can communicate heartache and make us feel it more deeply. Music has a language component. If there are lyrics, they can elicit speech, even in people who have experienced strokes. Maybe they aren't able to speak, but they are able to sing by using a different part of their brain. If I were to sing like, please don't take my sunshine up, you may have a natural instinct to just to fill in that last word and jump in. It can be used to elicit speech in a tailored speech intervention. There's a cognitive component. You need to pay attention when you play music. You need to pay attention when you're listening to music. Music has a rhythmic and timing component. It could help you sync your steps if you're learning to walk due to a physical impairment. It can last a specific amount of time. Like maybe you have a song that is a certain length and you can continue an activity for a certain amount of time. And it also has a social and cooperative component. If you're playing music with multiple people, you have to read nonverbal cues. You have to listen to each other. You have to respond. So the way we use music can be crafted to serve so many different kinds of goals. It makes it very cool and versatile. So when we're using music to reach non-musical therapeutic goals, if you had a physical goal, maybe it would be to lower heart rate. Notice the goal is not play the drum really well. The goal is not really enjoy listening to this song. It's something more concrete that relates to that person's life. An emotional goal might be identify emotions in a song. Cognitive could be to sustain focus of attention. A social goal could be to initiate a social interaction, Or a communication goal could be choose one of 2 instruments and communicate that to me. Who can benefit from music therapy? So many populations, due to how versatile music is in touching those different parts of our daily life. You can see anxiety, bipolar, borderline, depression, eating disorders, physical needs, social, emotional needs. Who can benefit from music therapy is really broad. Maybe you know someone in your life who could benefit from music therapy. Maybe you personally could benefit from music therapy. The populations a music therapist can work with are very broad. Where do we work? All over. We can be in hospitals and schools, adult day facilities, working with veterans, military bases, hospice, rehab, correctional facilities, community centers, homeless shelters, in individuals' homes. The goals would be personalized in each instance. The goals would be very different depending on the needs of those people. But music is versatile enough to be up to the challenge. A common question music therapists get is, do I need to have a music background or music skills to be a good candidate for music therapy? And the answer is no, definitely not. Being a successful participant in a music therapy session is not contingent on any music background whatsoever or music skills whatsoever, because the therapist is creating interventions for you to work on those non-musical skills. So no music background, no music skills necessary. Don't ever shy away from a music therapy experience because you feel like I'm not a good singer. I never took music lessons as a child. That's not relevant. You don't need a music background. I'd like to give you a quick history of music therapy. And here's a question for you to think about. How old do you think music therapy as a therapeutic method is? Is it very old, like a part of ancient civilizations? Or is it fairly new, like a modern approach from the 20th century? And the answer is both. A quick snapshot history of music therapy is music and healing have been paired since early civilizations. We have evidence of music's role in ceremonies and rituals. We know Aristotle and Plato wrote about music being the medicine of the soul. They picked up really early on that music has the power to create change in us, though the mechanisms of exactly what was going on weren't quite known. In the United States, we have evidence of writings in the late 1700s and the early 1800s, where they were noticing how music and medical diseases were connected and some outcomes were related based on how music was engaging with clients, but they still didn't quite know what was going on. The evidence was pretty anecdotal. In the 20th century, we see a big change in our understanding of how music can function. Post-World War I and World War II, in veterans hospitals, there were many veterans experiencing extreme PTSD and extreme trauma from their battlefield experiences. When they came back, there were volunteer musicians in some of those veteran hospitals. They weren't music therapists the way we have music therapists now, but they were engaging with those veterans, and the doctors and nurses noted it. They noted that change, and they would request more musicians. They would request more volunteers. They would ask those volunteers to train more musicians to come in because they saw the need and they saw the outcomes. In the early 1900s, there were some short-lived music therapy associations that were around for a little while and fizzled out. But we get the first how-to textbook to train music therapists in the 1930s. The 1940s had the earliest college training programs. In 1998, think about how recent that is. That's when the American Association for Music Therapy, we call it AMTA, if you see it in music therapy research, merged two separate organizations to create one big one that is very proud of its advocacy, its education, its training, its scholarship, and that is our guiding organization as music therapists today. So it's very old. People have been using music for a very long time, but the understanding of the research and how music affects the brain and our bodies is very new and still emerging, and we are still learning more. To become a board certified music therapist, it's kind of a long path. We attend a college program that is approved by AMTA, or our organization. We have 1,200 hours of clinical training, including practicum while we're in college, plus a 6-month full-time internship afterwards in a site where we work intensively. Then we have to pass a certification exam. And if you're in Wisconsin, we also need to apply for Wisconsin licensure. So there's another step. We, as professionals, complete 100 hours of continuing ed every 5 years. So we're always staying on top of this emerging body of research. And some music therapists go on to complete a master's or a PhD. So the music therapist that you work with, if they are board certified, has a lot of training and continues to learn and understand the most recent techniques. In school, our coursework spans a very cool mix of different departments. We have music classes the way a music major might, like where we take music lessons and play in ensembles and learn about music. We have special music therapy classes where we learn about how to work with different populations, like older adults or children. And then we have other like science-based classes. We take biology, psychology, child development. We learn how to conduct research well. Sometimes we take statistics. So music therapists have interest in a lot of different areas. What does the session look like? Usually there's an early collaboration where we meet with you, the client, or the caregiver to really dig into what the needs are that we're trying to address. We use that information to create goals and objectives. Maybe you have a physical goal, and then the objective deals with something more specific, like arm extension or gait training. From there, we implement music-based interventions. We use the best research to create the most effective music experience that we can to address that non-musical goal. Rhythm can be a really common component that we emphasize, and no musical skill or background is needed to be successful. Interventions examples may involve a performance or improvisation or writing a song or lyric analysis, maybe music games. But I hope you remember that even though a performance may look like music education, where a performance is a common outcome at the end of a semester, that the goal of the performance is probably something else. Maybe working on confidence or working on teamwork. Some non-musical goal is behind those music-looking experiences. And music is our glue that holds all of this therapy together because of its predictability. It has structure we can manipulate. It can evoke creativity and has sensory components that other therapies may not. We have lots of elements of music that we can manipulate. If you or someone you love is in a mental health treatment plan right now, music therapy may be able to fit into part of that. If you are in a therapeutic approach that's dealing with affect, maybe you're emphasizing moods, feelings, and emotions, exploring conflict. Music can fit into something like that. Music's often called the language of emotions, and music could be used like to guide imagery, evoke emotional responses, and a music therapist could work with you on those pre-existing affect goals. On your own, some self-care ideas I'd like to offer you are learning an instrument, or revive old skills. Maybe you played piano or guitar as a child. You could revive something like that as part of your self-care. Or you could improvise music to express emotions. If you are in a treatment approach that emphasizes behavior, believing that conditioning can be an important component of behavior that is seen, music can be used as a reinforcement. Music is naturally enjoyable and could be used as a reward in some situations, or just as a boost to encourage different behaviors. In your own self-care, I encourage you to take a moment right now. Think of something you want to increase in your life. Maybe you want to increase how often you exercise, or something simple. Think of the thing you want to increase. And now think about, how can I use music to reward that choice? If you want to exercise more, maybe you have a favorite playlist that you just bring out when you are going on a walk, or something else you come up with where music is rewarding and part of your plan for the outcome that you want. If you're focusing on cognition, maybe you or someone you love is in CBT, cognitive behavioral therapy. You might be focusing on what you think about an event, and that thought can have an enormous impact on how you end up feeling and acting. Music therapy can fit into that approach as well. A music therapist could guide you through lyric analysis, breaking down the text or the poetry of a song to explore beliefs and jumpstart a conversation. I thought we could try this together today. I'm going to sing the song Let It Be for you. And the challenge I'd like to offer you is to think about, during this song, what thing or things in your life do you need to let be? What do you want to let go of and let be? See if this song can help you identify those things in your own life. And it could be something really big, or it could be something pretty small. When I find myself in times of trouble, Mother Mary comes to me, speaking words of wisdom, let it be. And in my hour of darkness, she is standing right in front of me, speaking words of wisdom, let it be. Let it be, let it be, let it be, let it be. Whisper words of wisdom, let it be. And when the broken-hearted people living in In a music therapy session, then we may break down a song like this, or that that is connected to your goals, and use that to start examining those bigger goals that you have in a session. Music is the tool to dig into those larger needs. I'm going to play a little more music for you, and I would like you to just monitor in your own body if you feel any changes while I play. Do, 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 do. Do, 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 do. Maybe you notice some small changes in your body. It could have been your toe tapping when the song sped up. It could have been breathing a little bit more deeply when the song was a little bit slower. Maybe even something else that you noticed in your body. What I was hoping to help you experience is something music therapists use called the ISO principle. The takeaway of the ISO principle is that our bodies sync with music in ways that sometimes we notice, like our foot tapping, and in ways that maybe we don't notice right away, like our blood pressure changing or our heart rate going down. In general, with faster music, we sync with those faster internal rhythms. Our body just clicks along a little faster with slower music. Sometimes we internally slow down as well. Something you can do to use the ISO principle in your own life is you can match your state, like a calm state or a really energetic state, with music. If you want to get to a different state, maybe you're trying to go to bed and you're really wound up from the day, or the opposite, it's like hard to wake up in the morning and you need to get moving, get more alert for a work meeting later that day. You can gradually adjust music to reach your desired state, and our body is going to click along with that music in ways that we notice and don't, and help move you along. Something you can do for yourself right now is think about playlists that you can build for yourself for your own life. You can create your own playlist for unwinding and relaxing, like getting ready for bed and you just need to start unwinding, move a little slower. Maybe you would have slower tempo, softer quality songs for a playlist like that. You could have a playlist for regular medium energy stuff during your day, like driving, like chores, that middle energy that gets us through the day. And you could have your own playlist for high energy stuff, like when you really need some courage and you need some motivation, or you really need to amp up a workout while you're exercising. And then you can mix and match those playlists to move from energetic to calmer or calm to more energetic. And if you have paper nearby, I invite you to just jot down some songs that you love that might fit into one of those 3 playlists that you can use in your own life. The ISO principle, again, just means that we sync biologically with music, and we can use that to our advantage. This activity I'm going to guide you through is kind of like what we opened with. It's a kind of music meditation, but we're going to use even more of our brains while we do this. I want to add a visualization component where I want you to imagine what the sound of this song evokes. This song I'm going to play for you is called Dance of the Fish. And I gave you a picture as a prompt, but I invite you to close your eyes and imagine your own scene. Imagine the textures and the colors and the smells, and see if you can really create that place. We are trying to reduce stress and quiet that inner voice and just be for a few minutes. This is something you can do on your own with other music that evokes an image or an idea. So I invite you to imagine ocean or water or some other relaxing aquatic scene to this song. Adding that visualization component can add greater relaxation. It can more fully pull us away from that busy inner voice that sometimes won't stop. And as music as self-care, that is something you can try at home. Find a piece on YouTube that is a piece of classical music that evokes a natural scene, maybe Morning by Edvard Grieg or Clair de Lune, Moonlight by Claude Debussy, and use that visualization part of your brain to more deeply detach from those busy thoughts and more deeply focus on the music. It's something you can try at home or as part of a music therapy session. Music can also support other relaxation techniques that you may already be familiar with. Music therapy did not invent these, but music can support them from the rhythmic and tension and dissonance standpoints. I thought we could try a little bit of progressive muscle relaxation together so you could see how music supports it. This is something you could do in a music therapy session with a therapist. So in progressive muscle relaxation, you're going to sit in a chair and we will systematically tighten groups of muscles. As you breathe in, you're going to tense hard, but not to the point of pain or cramping. If it's an uncomfortable muscle location for you, please feel free to skip it. We want you to be comfortable. And we'll tighten for 4 to 10 seconds. Then we'll breathe out and suddenly and completely relax that muscle group. And we'll relax for 10 to 20 seconds. So I invite you to sit comfortably in your chair. And we're going to start by scrunching up our face. 10-set group of muscles, and breathe out and relax that muscle group. Next, we're going to tense our arms. Here we go. Breathe in and tense your arms. And breathe out, suddenly and completely relax your arms. Next, we're going to do our shoulders and chest. Here we go. Breathe in. And relax them. Next, we're going to tense our legs. Again, you can skip it if that's an uncomfortable muscle group for you. Tense your legs and breathe in. And relax. And to close, I invite you to take one big breath in and breathe out. That was a really abbreviated demonstration of how you can use a pre-existing tool like progressive muscle relaxation and reinforce it with music to make it more successful. Some other breathing techniques for relaxation I'd like to share with you that music can support. You can try these at home. Box breathing means that we inhale for 4, hold for 4, exhale for 4, and hold for 4. We can try this out together. And I'm going to use music to prompt it. We're going to inhale for 4. Inhale. Hold. Exhale. Hold. Inhale. Hold. Exhale. A different breathing technique that you can use at home in your self-care for relaxation is called resonant breathing. This is calming and can be very efficient for some of our bodily functions like your heart and lungs working well together. You're going to think about breathing in a circle with no stops in this one, where you inhale and then turn right back around, exhale and inhale again. I'm going to use music to support this while you give it a try. We're going to inhale and exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Those are techniques you can try at home as part of your self-care. We are back to the beginning of our presentation, and I would like you to take a look at these possibilities one last time. And ask yourself, is this music therapy based on what we learned today? Or is this something else, music being used in a different way? And our answers are these. Singing with an older adult with Alzheimer's to increase verbal communication means that you're working on a goal that is not specifically singing. It's not specifically music. We're working on verbal communication, which matters to that person's quality of life. If you're using music as a focal point with patients to distract them so that they feel less pain, that's not music entertainment. That's trying to alleviate their pain. When you're working with premature infants to improve sleep and increase weight gain, music can be used as a reinforcement where it's played while premature infants are feeding and stops when they stop feeding. That's working on their health and their feeding. When using improvisation and drumming to increase communication and self-expression, that's not just a leisure activity, that's working on one of those bigger goals. And at this point, I would love to address any questions that you might have. I'm going to pull up the chat. If you have a question that's been on your mind that you didn't get a chance to type, please send it to me now. And I would love to answer any music therapy questions that you have.
Yes, Erin, so one of the questions is, do most music therapists have a niche with a certain instrument or genre or range of mediums they use? Or does it depend on the client?
I love that question. Music therapists usually have a primary instrument that they were trained in. Maybe they played like flute in high school band, but as part of our training, we are trained in guitar and piano and voice. So we're competent in all of those. We may have our own personal preferences based on the playlist that we have in our own lives, but we are trained to use all kinds of music, like country, like rap, like oldies, because we feel it's really important to use client preferred music whenever possible to increase that success. Like if you prefer your grandparents' music and you're using your grandchildren's music, you're gonna have a disconnect and be less successful. So we try and learn, what do you as my client prefer and how can we use that for your non-musical goals?
And so I have a question. Tell me, how are you reimbursed as a music therapist? Is it insurable, or like, can you, how are music therapists reimbursed?
It can be complicated. Music therapy is a newer field. Like it's ancient, it's very, very old, but it's also very new. So reimbursement can vary state to state. States that have licensure, like Wisconsin, have more venues for successful reimbursement, but it can be challenging and it can be on a case-by-case basis or a setting-by-setting basis, exactly how that reimbursement works. If you're interested in music therapy and think it could be an appropriate therapy for you, I encourage you to reach out to a music therapist and they can best inform you about your reimbursement options if you're a good candidate.
And do you get, do you have providers, physicians, nurses, psychologists refer clients to you?
Yes, medical professionals, other community professionals like teachers can all be referral sources, or people can self-refer.
Okay, great.
An assessment is the first step after any referral. So it doesn't mean you automatically are in music therapy treatment, but it definitely starts that process and starts the dialogue.
Great. And then I have one more question, and then I see we have one. So NAMI spends a lot of time doing group therapy. We have support groups, family support groups. It's like, so I hear you talk a lot about doing one-on-one therapy. Do you ever do like a group therapy session?
Absolutely. Groups can be directly related to a client's goal. especially if they have like a social or communication or cooperative goal. A group is the perfect setting for that. If we're doing a support group and lyric analysis, having a group around to bounce ideas off of and relate to other people can be very powerful. In some cases, a one-on-one can be the most appropriate for that client. It depends on the setting. Like if you're in someone's home or if you are in a particular facility, whether you would be a part of a music therapy group or an individual session.
Great. And then how often should you use music for your own self-care?
I would say that's a really personal thing. Maybe as much as you want to or you think you need to. If you really love music, I invite you to try using music purposely for your self-care rather than just being on in the background. Use it where you really listen and absorb all of those fast tempos to adapt to that faster energy of a song, or really visualize what the lyrics are telling you about. If music's not really your thing, maybe you would use music a lot less or minimally or not at all. It's really open to the experiences you want to have and the benefits that you feel from music for self-care.
I want you to follow me with your harp because that was very relaxing. I really enjoyed your harp music. Rachel asked, I work with 0 to 6-year-olds in a consulting role through a public school system. Any advice on using music for social, emotional development with young children?
Oh my gosh, what a population where music could be so powerful. Rachel, if you have like really specific ideas, I invite you to collaborate with a music therapist, like even in a consulting capacity. They could draw up really specific ideas for you, but you could use the ISO principle just on your own. If you're even just trying to regulate a group and they're really energetic, start energetic with your music and start to slow it down. You can use music as a part of turn taking. You can use music to improvise something together. You could use music to play feelings and have someone guess. The sky's kind of the limit. So I encourage you to reach out to a music therapist, like even like over coffee. If you had a conversation, maybe you could have a bunch of ideas.
Well, thank you so much, Erin. I see that your website has musicspeakstherapy.com has been added to our chat. So if people want to reach out and consult with you on potentials for music therapy in their practice or in their lives, please reach out to musicspeakstherapy.com. And we really appreciate you sharing your information with us today and supporting NAMI in this way. And please, before you exit today, please quickly, we have a survey that we would love for you to complete about this presentation today. Erin, thank you so much for all of your insight on music therapy. We really appreciate you joining us on our webinar Wednesday, and thank you for all the information you shared.
Thank you so much. It was a real privilege, and thank you everyone for an hour of your time to learn more about music therapy. I hope it gave you a clearer idea of what music therapy is and isn't, and some ideas for caring for yourself with music.
Great, thank you. And please join us for our next 2 Wednesdays, same time. Well, no, next week it starts at 1 o'clock. 1 o'clock next week, and we look forward to seeing everyone again next week. And thank you again, Erin.
Thank you so much.